Welcome to Dermat Vet. Dear friends, I know you were missing me a lot, but I was busy into a very important assignment. I'm so happy to inform you that we have started a 24 hours ICU for injured dogs and cats at Planet Animal Hospital, and I was a little busy in upgrading those facilities. So my dear friends, I am back as a dermat vet, and today I am going to talk with all of you about recurrent pyoderma and an infection which you always face in your routine cases. Let us talk about a case. An 8-year-old female spayed mixed breed was presented for recurrent bacterial pyoderma. The owner was very much confused because the dog was gaining weight recently and was slightly lethargic. On closer examination, these lesions were noted multifocally along the abdomen and the trunk region. Now, dear friends, routine CBC showed thrombocytosis and lymphopenia. Serum biochemistry is very important, which showed severely elevated alkaline phosphatase and mild elevations in aminotransferase and cholesterol. Now, this dog had no history of any previous medical abnormalities, including any severe dermatological issues. So, what is the most likely diagnosis of this patient, and what manifestations are associated with this disease process? Let us talk about this. Dear friends, this is hyperadrenocorticism. Because the dog had no previous history of glucocorticoid administration, spontaneous hyperadrenocorticism is most likely to be a cause. It is a pituitary dependent hyperadrenocorticism accounts for approximately 85% of canine hyperadrenocorticism cases. This is nothing but a pituitary microadenomas and are 15% due to a functional adrenal tumor. So other possible causes include atopic dermatitis or secretion of atrophic adrenocortical receptors, but these are extremely rare cases. What are the symptoms? Alopecia, hair loss, as you know, typically bilaterally symmetrical, sparing the head and extremities. Failure to regrow of hair following shaving or grooming is also reported. Once you shave or groom, the chances of hair regrowth is very less. Alopecia is due to steroid-induced atrophy of the hair follicle. Keratin-plagued follicles occur due to accumulation of debris in an atrophic follicle, or maybe secondary to demodicosis or bacterial pyoderma. So recurrent bacterial pyoderma is very common in these cases. With no prior history of any classical clinical signs like polyuria or polydyspia, they are not there. Skin infections may be further complicated by seborrhea unless there are secondary pruritic triggers, example pyoderma, malassezia, overgrowth. Pruritus is uncommon. So dear friends, this was all about hyperadrenocorticism. We have to always keep this in mind while treating a skin infection. So this is a typical case which I wanted to share with you. Please share this video with your friends, fellow practitioners, vet students, and consider subscribing Dermat Vet if you found this video informative and interesting, and don't forget to press the bell icon to keep getting notifications from Dermat Vet.